Hi, this is Dr. Bonnie Boles, Vice President of Clinical Integration at Tanner Health System. I'd like to talk to you about why we are continuing our efforts with social distancing and sheltering in place, and we've had a lot of good questions as to how what's happening now differs from the seasonal flu. So let's look at why our goal is to act aggressively now so that hopefully by this fall we'll enjoy more of our previous freedoms and tailgate parties and football season or whatever you enjoy in the fall. This pain that we're undergoing now and the toll it's taking on you and your families by sheltering in place and social distancing, we hope will be well worth it. So let's take a look at seasonal influenza and how it is spread. Typically one person infects another person, and that's called linear growth or spread of a virus. And I'm going to show you a line that depicts that. If we look at H1N1, we've had some questions about why this is different than the 2009 swine flu, which was also a pandemic. In that case, one person on average infected about 1.5 people. If you look at COVID-19, what we're seeing is on average, one person is infecting 2 to 3 people. And this leads, as opposed to linear growth, exponential growth. So let's take a look at this graph. This is a little, and this is a lot. Linear growth, like seasonal influenza, is paced and slow, like waves coming and going. You can handle it a little bit at a time, as opposed to exponential growth, which is what we see with COVID-19, which is more like what some people have called a tsunami, a giant wave coming at one time. And this is what's giving everyone pause as far as medical resources and supplies. Now, we are planning for that and doing everything we can to be ready, but what we're asking you to do is helping us plan, because we hope that we will see less of a tsunami. The wave won't be as giant. So thank you for all that you're doing to shelter in place and social distance, and I hope this helps you understand why this is different than seasonal influenza and why it is so important to heed these warnings and stay at home now, so that the pain we're enduring now with this shelter in place will lead to a payoff later and this won't continue to drag out. Thank you.